All right, we should be live now. Sorry, we're just a couple minutes late. I got a new computer and was trying to figure out how to get it logged in. So I think we're good now. What we'll do is we'll start with a update. Can you hear me all right, Stuart? All right, we should be live now. Yeah, looks like I'm getting some. Couple minutes late. I got a new computer. Let me try to figure. There we go. Okay. As far as our update goes, right now in our district, we have had a total of 1,791 cases in Adair, 1,348 cases in Casey. This is through last night. 1,445 cases in Clinton, 674 cases in Cumberland, 1,189 total cases in Greene, 1,935 cases in Macquarie, 6,125 cases in Pulaski, 1,811 cases in Russell, 2,929 cases in 1,000. Let's see, where was I at? Do you know where I got to, Stuart? I lost my place. I was somewhere. 2,929 in Taylor, if I got that far. And Wayne, 2,171 for a total of 21,418 total cases. Active cases, we have 17 in Adair, 24 in KC, 6 in Clinton, none in Cumberland, 6 in Greene, 28 in Macquarie, 52 in Pulaski, 6 in Russell, 10 in Taylor, and 13 in Wayne for 162 active cases. We've had a total of, or we currently have 24 in the hospital, and the rest of those active cases, 138, are in home isolation. And so we've released a total of 20,874 of our cases, and we've had 382 deaths. So those 382 deaths, that's 1.78% of our total confirmed cases have passed away. That's about 1 in 56. We have had a total of 1,190 hospitalizations, which is, of the known cases, 5.56%, or about 1 in 18. So over the last few weeks, our cases have been declining. Over the last couple of weeks, that's sort of stabilized. It seems like every day we kind of go back and forth between, did we add more cases than we did for the day of the previous week or not? So that kind of just goes up and down day by day. So we've sort of plateaued on our decline. And that's kind of where we are. It's certainly, things aren't nearly as challenging as they were in January and late December and early January, and that's good. As far as our vaccination efforts, I have read a couple of news articles lately that was looking at our district, saying that the folks in our district may not be vaccinated as much as other parts of the state. But the way that is tracked on those maps, it's not tracked by the residence of the person who got the vaccine. It's tracked by where the vaccine was given. And our district was, we weren't one of the first places in the state that had a big mass vaccination site. So, we don't know how many people in our district traveled outside of our district to get it. Those numbers would show up in the county where they got the vaccine. So the best we can tell by looking at how much vaccine is coming into our district each week and how much is being moved, I think we're pretty well in line with everyone else in all of our counties in the state. When I was looking at the CDC map yesterday, it was just over 45% of those who are 18 and over who had at least one dose of the vaccine. That's, Kentucky's in the top 10, maybe in the top 5 or 6 in the nation as far as getting people vaccinated. So we're doing pretty good. As far as that goes, we are seeing a little more challenge getting people scheduled for their appointments. we're getting 1,000 doses a week, and we've pretty well been able to move what we've received, but we have had some other area providers say it's getting harder to fill their appointment slots. And it's harder for us too. We have to do more outreach and work to get those appointment slots filled. If we really are at about 45% of our population having had the vaccine, we're still probably about 40% away from what we need. Well, it'd be good to get 100%, but we really need 85% or more to feel good about what we've done. And that was the last thing I read. Dr. Raymond, is that pretty well close?
Yeah. 85% vaccination rates gives you herd immunity, which is what we want to stop the pandemic and go back to normal.
Yeah, so
we know that vaccination prevents illness, but more and more data is available that shows that it also stops transmission.
Yeah, so trying to keep it from spreading. Yeah, we of our total population in our district, it's only just over 10% of our population who have had the disease. I was trying to look at the number exactly through last night. Let's see if I can find that. 10.25% of our population, so 21,418 known cases. And if we say 45% of the population has been vaccinated, well, some of that 10% who's had the disease also got vaccinated. So maybe we're at close to 50% of our population having had one dose, maybe somewhere between 40 and 50%. So we still got a good ways to go. And we know that on the global level, there's a lot of countries who are experiencing surges right now. So at the global level, cases are going up. At the national level, cases have been going up. Maybe that's starting to plateau a little bit, but when you look on the CDC's maps, there's quite a few states now that are going upward with their cases. And maybe that's because the new variants that are coming in, like the UK variant, is more aggressively spreads. As so far, the vaccine seems to be holding up well against all the different variants. But as far as preventing illness and hospitalizations, but for the people that's not vaccinated, those new variants can spread much more quickly than the earlier variants. So we would like people to get vaccinated as quickly as possible. Anyway, that's probably all I had to say as far as updates. Dr. Wayman, Stewart, do you want to add anything?
Well, I want to say a few things about why we should get vaccinated. Obviously, the first one is to prevent illness in ourselves and hospitalization and death, but also to prevent consequences of the illness. Many people who survive moderately severe disease live with consequences. They either have heart disease because of myocarditis, or they've had a stroke, or they lost limbs because of clots in their arteries, or they even have something called the long hauler syndrome, which is a bit like fibromyalgia with brain fog. So quite a high percentage of people end up with these consequences, even if they've had mild disease. So really is something we'd like to stop from us having it. Obviously, we want to stop the pandemic, as Sean said, and achieve herd immunity. And of course, all that will mean that we can return to normal life, travel, eat out, etc., which we are all looking forward to.
We sure are. Stuart, do you have anything to add?
No, I was just gonna, are you gonna, only to add that this week we were able to start giving Johnson & Johnson here. Now, our supply may not be a steady supply right now, but we did see an uptick in filling those appointments. We were able to fill, I think, a couple of weeks worth of clinics whenever we announced that we had that available. So that's a good thing.
And apparently there've been some questions about what age these vaccines are good for. So the two vaccines that we have, Johnson & Johnson and Moderna, are only approved for 18 and up. Pfizer is 16, but we do not have that at the health department. The other question that was asked is, how are these vaccines different? Well, Moderna and Pfizer require 2 doses and Johnson & Johnson 1. They all make our bodies produce spike proteins, which are identical to what's on the virus, and that's how our immune system responds. They have slightly different ways of delivering the message to make these proteins. And I think the last one was about questions with side effects. Side effects are pretty much the same. You can get flu-like symptoms, headache, fatigue. They may be a little less with Johnson & Johnson, primarily because you only get 1 dose, whereas it's the second dose that seems to make slightly higher rates of side effects.
Let's see, we do have some people listening in live, and we don't have a lot of questions submitted today, so we won't be on for long. If you have anything you want to text or type in the chat box, if you've got a question you'd like for us to answer, please go ahead and do that now. I'm looking at our line list for hospitalizations, current hospitalized cases. We have 24 cases in the hospital right now. I just wanted to give you an idea of age ranges here. So 49 and under, we have currently 5 people hospitalized, 49 and under, a 34-year-old, 44, 49, and 2 48-year-olds. So, you know, don't think any of those people had been vaccinated. Let me go over here and look. Nope. So, you know, that's some pretty young people there that's going to have, somebody's going to have some large doctor bills, and who knows if they're going to get through this okay or not, you know, but that's, there you have that. Now let's look at the 50 to 59 age range and see what we have. We have 4 in the hospital in that range, 55, 58, 56, and 51. And then we'll go on above that. Let me get the rest of them in here. And then above the 59 is 15 people in the hospital, 75, 88, 84, 63, 62, 67, 78, 92, 85, 74, 80, 90, and 71. So obviously it's still harder on, you know, those that are 60 and older, but there are people 59 and under who are still being hospitalized for this. And being in the hospital and being on a ventilator is not a pleasant experience. So I wouldn't recommend it for anybody. Let's see. So again, those that are in the 50, make sure I'm doing this right, in the 59 and under right now, currently we have 9 in the hospital. So that's a fairly good number of people that are ending up being hospitalized. All right. Now I apologize. I'm skipping around a little bit. I just got a new computer and I'm getting all kinds of pop-ups and learning how to use this thing. So the vaccines in our area, as we talked about, there is a few locations that have Pfizer in our area. I don't have those off the top of my head, but our call center knows those locations. And then on our website, we have most of the places that have vaccine listed, along with how you schedule an appointment, either by phone or if they're having do it by text or by, you know, online sign up. So I have those listed. You know, there's plenty of vaccine right now. Everyone that wants one should be able to get one. There's a Johnson & Johnson in our district. There's Moderna. There's a little bit of Pfizer. So you should be able to find what you want. We would certainly encourage you to get it. And in the meantime, until we get closer to 85% of our population having had the vaccine, it's still important to social distance and mask. Hopefully before the summer, we will have had enough uptake to where a lot more of the restrictions can be lifted. So I know the governor announced yesterday, if you're traveling inside the United States domestically and you've been fully vaccinated, then there's no recommended quarantine once you return from your in nation travel, your domestic travel. So that's something that's, I guess, to look forward to as far as family vacations and things. But we would caution you, if you're going on a family vacation to a place that's got more transmission, even if you're fully vaccinated, it still would be wise to social distance and mask. The verdict is still out right now. You can still catch it, and you may not know you have it because you've been vaccinated. It may make the symptoms so mild you may not know you have it, but it may be possible to bring it back and spread it. So just be cautious. Is that right, Dr. Wayman, or am I?
That's what we are saying, to be cautious, but more and more data show that we really don't spread it.
Yeah. So as the data becomes clearer, then maybe the CDC will even recommend more of the restrictions be lifted for people who are fully vaccinated. So we all look forward to that. That's what we want, for sure. Anything else, Dr. Wayman? You're more up on that than I am.
Well, there are lots more studies now about the real world efficacy of these vaccines, and they are truly amazing. So yes, you should get vaccinated. I mean, they've looked at populations, not from the trial, but from, those people that have been vaccinated since the end of December, and they are 95 to 97% effective at preventing severe disease and around 90% effective at asymptomatic disease prevention. So they're great, amazing, and probably better than any vaccine we've ever had.
Well, that's good. Stuart, what are you thinking about today? Anything you want to add?
The only thing that I wanted to add is, if you're a business and you have several employees there that would like the vaccine, if you will reach out to either me or Sean or Dr. Wayman, we may be able to set up a clinic on site at your business. We do have a mobile van, and we're able to do some of those. So if you would like that, reach out to us, and we would try to work that out.
Sure would. One of the questions that I get asked quite often, Dr. Wayman, and we've addressed this a couple of times, but people ask me if the virus mutates enough or shifts enough to where the vaccine's no longer effective, are we going to be right back where we were when this thing all started? And I'm thinking about from the perspective of how quickly can the vaccine be developed now that everything's in place to do it. It wouldn't be like starting over. And I was wanting you to talk about that.
You're absolutely right. And in fact, the companies are already making vaccine and doing trials on slightly different modifications to make sure they cover all these variants. The one good thing is that we are making antibodies at multiple little bits of protein on the surface of that virus. There are lots of little, if you've seen pictures of them, it's like, a hairdo, all sorts of little spikes. And so these spikes will make antibodies against all of them. So if one spike has a mutation, we still make antibodies against the other bits. So when we talk about spike protein, we really mean spike proteins with an S. And so far, all the vaccines are good against the current variants, if not completely, then at least in preventing severe disease. The ones we're concerned about are the South African and the Brazilian one. The UK is pretty much covered. This RNA virus does mutate, but it doesn't mutate as much as the flu virus, which is just totally crazy. And we absolutely need a different vaccine every year. But yes, if it changes enough where our vaccines are useless, we will have one probably in the pipeline.
So that's good news. So if we can just get through the worst of where we're at, the future is a lot brighter in a lot of different ways. Even if the thing mutates, we can get a vaccine much quicker.
And of course, if we don't produce the variants, and the way we produce variants is to have lots of transmission, which means people get sick, and while they're sick, they're making mutants. So let's not do that. Let's get vaccinated and covered and lower the transmission rates and infection rates.
Yeah. And right now, where there's a vaccine shortage in the world, you know, the governments of the world, in the United States, the CDC is kind of overseeing which providers get the vaccine and how much each state department for public health gets. And the way that the way the vaccine is delivered out to providers is much different. Generally speaking, like for the flu vaccine, it's an annual vaccine, but pretty much we know about what percent of the population is going to take it, and there's enough produced, and all the different providers, whether it's a doctor or whatever, you know, all the different doctor, anyone that wants to be a provider just orders it through their regular vaccine vendor, and they get a supply in, and you just get it at your regular doctor's office. And what I'm saying is, you know, it's really unique right now where we're at the beginning of this thing. But even if it continues on, it's going to be much more normal thing to deal with going into the future. I don't know if I'm making sense. I'm making sense to me, but I'm not making sense to anybody else. So we do have a question. It says somebody wanted to know if we have many of the variants in the district. Sorry, don't know if that was answered already. No, we haven't answered that. Dr. Williams, which one do you know of specifically that's been in our district so far?
I don't know specifically about our district, but I know that Kentucky's having the UK variant circulating.
Yeah, and if it's, the governor read off a list of Kentucky counties the other day. It was 12 or 15 or 20. If it's in that many counties, you can just assume it's everywhere. Because
Since we don't test every single case, we don't really know. We just know that it's here, and if it's here and it's more transmissible, I'm sure that's what we're all having now.
We all understand it's extremely difficult to stop a virus from spreading, you know, completely around the world. There's just too much travel. I mean, you think about any of the counties in our district, how many people go out of our district every day to work? And how many people come into your county every day to work? And how many people are traveling to go visit family or whatever, going out of the county, out of the state, going on vacations? I mean, you're just constantly on the move, and it's really hard to keep a virus contained to one location of the world, unless it's a really virus that spreads very, very slowly, that you can stamp out. I mean, anything that moves quick like this COVID moves, spreads quickly like it does. Well, it's really hard to stop it. There's a better epi way to explain that, Dr. Lehman, than what I did. But it's hard to stop the disease. So I guess I'm bringing that up because I know there was a time when, you know, a lot of people was saying, you know, why isn't there different rules for one county compared to another county based on how much virus you have in your county? And the only way something like that would work would be if if you had all the roads closed at the county lines and nobody was coming in or out. And that's not the way it works. So, you know, if Pulaski's having a lot of cases, all the counties around it is going to be having a lot of cases too. It's just you can't stop it. So while we don't know of cases of the UK variant in our district, you can just pretty well assume there are. Yeah. Okay, I don't see any more questions. It seemed like there was something else I wanted to cover, but it slipped my mind. Anything else you guys have today?
I'll just say that we've vaccinated several thousand people. A lot of those people are elders, 70 and older. A lot of those people out there, remember, if you're out and about and think that this thing's over, for a lot of those people, this is not over. I mean, they're scared and they take it very seriously, and we need to do what we can. We need to vaccinate ourselves to protect them. It's not just about if you want the vaccine to protect yourself, go get it, but it's to protect everybody. So it's all of our responsibility to do that.
Well, we know we got 24 people in the hospital right now. And if, let's say half of those had some sort of compromised health conditions that made them more susceptible to getting ill, half of those people didn't. There's half the people that are in the hospital, and probably more than that are the only reason they're in the hospital is because they contracted COVID-19. And if they had been vaccinated, if the people around them had been using precautions, if they'd been using precautions, maybe they wouldn't be in the hospital. Sometimes you can't avoid it. You can be masked and social distancing, and you can walk through a store and someone can cough or sneeze on you, and you just can't avoid it. But some of these people would not be in the hospital right now. Some of these people would not be on a ventilator right now if they had been vaccinated and if they had taken the precautions, and if the people around them had taken the precautions. So, if we can, as a population here in our district and in the state and nation, I mean, if we can all get serious this last 8-12 weeks and get the rest of that 40% that we need to get vaccinated, it's going to make everything go faster as far as getting back to normal, and it's going to prevent hospitalizations. It's going to prevent death, and that's what we want to do.
And Sean, I've got something for you and Dr. Wayman both. I'm not sure if you know. Do you know the total number of first and second vaccinations that at least the health department's gotten or given? And Dr. Wayman, can you then address, out of that number that Sean states, how many serious reactions we've had to that number of vaccinations that we have given and personally given as the health department?
All right. Let me see if I can answer the first part of your question. Let's see. And I probably updated my numbers a day or two ago. It may be a little different now. But we have we try to think if this is just first dose. Give me just a second. I'll make sure I'm telling you correctly. We've received 20,100 doses so far at the health department. Now, I'm not sure if that's first and second doses, but as far as reactions, how many negative reactions did we have? And we've received that, and we've given all of that vaccine, or almost all of it is scheduled to be given either the rest of this week or next week. So how many?
Okay, so we don't actually know what kind of side effects people have. However, I get calls from the clinics to ask if somebody should have a second dose. And those, I probably said, don't give them the second dose less than 5 times, maybe 3.
Yeah, and we know that there have been right close to 40,000 first dose vaccines given in our district. So 40,000, and you've had 3 or 4 instances where it was recommended not to get the second dose. So pretty safe. Is that what you're getting at, Stuart? It's pretty safe?
Yeah. I mean, I've heard, I get out and I hear in the community people talking and, even things about growing another another finger or leg. And we haven't had anybody to do that at all yet. And like I say, I've been personally involved in, I can't even count the number of clinics that I've been personally involved in here over the past few months. And, at the ones I've been present for, we've had nobody have a reaction here, take that shot and have any kind of serious reaction. Now, yes, people have, they have that normal immune response that causes them to not feel good for a day or two afterwards, potentially, and their arms sore. But none of that happens. And I think the last time, Sean, you and I talked that the potential for serious illness and lasting consequences of COVID outweigh any kind of potential of having some serious reaction to the vaccine hundreds of times over.
And furthermore, some people are worried about fertility issues. There's absolutely no evidence that it causes any problems with fertility, and there is no evidence that it causes problems in pregnant women or their fetuses. Now, the disease, on the other hand, there have been some studies that show that there may be fertility issues. I don't know if they're transient. So once again, vaccine's better than the disease. Furthermore, the immunity you get from the vaccine seems to be better than the immunity you get from the disease.
Yeah. And we know there's an awful lot of hospitalizations that happen when you get the disease, and a considerable number of deaths. So if nothing else, we do know that. So let me look and make sure there's no more questions in the chat. I got a lot of windows open here. No, I don't see any other questions. I think I'm kind of wrapping up. Unless Stuart or Dr. Wayman, do you have anything else? If there's anyone that's listening in and you want to type a question, you've got about 20 more seconds to do that before we punch out.
Just to say it looks like that we could be on the home stretch. Let's all just get together and do what we need to do.
Yeah. I do remember the one thing I was going to say earlier. I don't know how many kids are going to in-person instruction. I'm sure it's not as much as a normal school year. But after the holidays, when the schools started going back to more in-person instruction, we had a fear that we would see a big uptake in cases from that. I remember saying, I hope that's not true. Well, so far, it hasn't been true. So that was one of the things that we thought would probably happen that didn't happen. And that's a good thing to be able to admit we were wrong about, because we had seen that happen a couple times in the past. And so far, it doesn't seem to have happened yet. We look every day at where were people at before they were quarantined or isolated. And school's not one of the top areas. It's usually work or sometimes it's medical related or church, but it's not been schools. So, I don't know if the schools are just doing an excellent job, which I know they're trying their best to do an excellent job. If the parents are being more vigilant with their kids or what, but that seems to be working. A lot of the teachers got vaccinated, so that was good. Maybe that helped. Whatever the reason, we're glad that the kids going back to school hasn't created an uptick. So it's good for us to be able to admit when something that we predicted would happen didn't happen, and it's not happened yet. So that's good. We're happy that didn't happen. So anything else you all want to say before we sign off? All right. Well, thank you all for tuning in. Tracy is usually with us, but she's away this week, so I moderated the best I could. And considering I had a new computer with where I had to re-sign into everything and deal with the new pop-ups and stuff that you get when you got a brand new computer, we got through this okay. So it's good to see you all. We'll be back in a couple of weeks. Today is the 7th, so I guess the next time we'll do this is on the 21st. Again at 2 o'clock Eastern, 1 o'clock Central. So if you are interested, put that on your calendar for April the 21st. Thank you all for joining in.
Thanks.